Breaking Barriers, the Power of Stories in Mental Health. Welcome to a groundbreaking episode of the Black CEO podcast. Today, we're diving deep into a topic that's as crucial as it is often overlooked: the barriers to behavioral health treatment in the African American community. But we're not just here to talk about problems. We're here to explore solutions. And we've got a true powerhouse joining us to lead the charge. I recently had the privilege of sitting down with J.J. Winston, a woman whose impact on the world of mental health advocacy is nothing short of revolutionary. J.J. isn't just a novelist. She's a master-level trained social worker with 19 years of experience advocating for the behavioral health community, an attorney serving as a magistrate in family court, and a storyteller with a mission. Her novels, which have won multiple awards, are doing more than entertaining readers. They're changing lives and reshaping how we approach mental health in the African American community. JJ's work is a testament to the power of storytelling in addressing complex social issues. Her novels, The Anniversary and The Commemoration, have been recognized for their contribution to raising awareness about mental health issues. And let me tell you, her upcoming novel, The Revelation, set to be released in April 2025, promises to be a game changer. Now, you might be wondering, why are we talking about novels on a podcast about mental health? Well, buckle up, because we're about to take a journey through the intricate web of challenges facing mental health care in the African American community, and how the power of storytelling might just be the key to unraveling it. Let's start with a sobering statistic. 1 in 4 people are living with a behavioral health issue. That's 25% of the population. Look around you. In a room of 4 people, odds are one of them is silently battling a mental health challenge. But here's where it gets complicated. In the African American community, these challenges often go unaddressed, unacknowledged, and untreated. Why? Well, that's the million-dollar question, isn't it? And it's a question that J.J. Winston has dedicated her life to answering, and more importantly, to changing. Through our conversation, J.J. highlighted 3 major barriers that stand between the African American community and adequate mental health care. These aren't just abstract concepts. They're real, tangible obstacles that affect millions of lives every day. And trust me, once you understand these barriers, you'll never look at mental health the same way again. The first barrier is as old as time itself: cultural stigma. Imagine growing up in a community where seeking help for mental health is seen as a sign of weakness, where admitting you're struggling is met with whispers, side eyes, and judgment. This isn't just a figment of imagination. It's the reality for many African Americans. Jay shared a powerful story that brings this issue to life. She told me about a young man. Let's call him Marcus. Marcus grew up in a household where the mantra was always be strong, push through, don't show weakness. When he started experiencing symptoms of depression in college, he didn't know how to handle it. The idea of seeking help felt like admitting defeat, like letting his family down. So he suffered in silence, his grades slipping, his relationship strained, all because of a stigma that had been passed down through generations like a family heirloom. This stigma isn't just harmful, it's deadly. It's preventing people from getting the help they desperately need. And it's reinforced by societal norms and exacerbated by a deep-seated mistrust of the healthcare system, a mistrust rooted in historical mistreatment and systemic racism. But here's where JJ's brilliance shines through. Through her novels, she's found a way to address this stigma head-on. By weaving themes of mental health awareness into compelling narratives, she's normalizing conversations about behavioral health. She's showing her readers that it's okay to seek help, that it's a sign of strength, not weakness. In one of her novels, JJ created a character, a successful businessman who seemed to have it all together on the outside, but was struggling with anxiety and depression behind closed doors. Through this character's journey, readers got to see the internal struggle, the fear of judgment, and ultimately, the relief and growth that came from seeking help. It's through stories like these that JJ is slowly but surely chipping away at the stigma surrounding mental health in the African American community. Now let's talk about the second barrier: lack of representation in the mental health field. Picture this: you finally muster up the courage to seek help, only to find that none of the available therapists look like you or understand your cultural background. It's like trying to explain an inside joke to someone who doesn't speak your language. Frustrating and ultimately futile. JJ shared a story about a young woman, let's call her Tasha. Tasha had been dealing with anxiety for years.
and finally decided to see a therapist. But when she walked into the office, she was immediately uncomfortable. The therapist, while well meaning, couldn't understand the cultural nuances of Tasha's experiences. When Tasha talked about the pressure she felt from her family to be strong and not show vulnerability, the therapist suggested strategies that, while theoretically sound, didn't account for the cultural context Tasha was living in. Tasha left feeling misunderstood and didn't return for a second session. This lack of representation isn't just an inconvenience, it's a major deterrent. It leads to a lack of cultural competence among providers, which in turn leads to misunderstandings, misdiagnoses, and missed opportunities for healing. JJ's work doesn't just highlight this issue, it actively works to address it by inspiring more African Americans to enter the field of behavioral health. In fact, JJ told me about a reader who reached out to her after reading one of her novels. This reader, inspired by the portrayal of a black therapist in the book, decided to change her career path and pursue a degree in psychology. That's the power of representation. It doesn't just make people feel seen, it opens up new possibilities. The third barrier JJ discussed is one that affects many aspects of healthcare: economic disparities. For many African Americans, the cost of mental health care is simply out of reach. High out of pocket costs and lack of insurance coverage create a financial wall between those who need help and the services they require. JJ shared a heartbreaking story about a single mother. Let's call her Letitia. Letitia was working two jobs to make ends meet, struggling with depression that was affecting every aspect of her life. She knew she needed help, but the thought of paying for therapy on top of her other expenses felt impossible. So she soldiered on, her mental health deteriorating, affecting her work, her relationships, and her ability to care for her children. This is where JJ's novels come in again. By raising awareness about these economic barriers, she's not just entertaining her readers, she's educating them. She's empowering them with knowledge about available resources and advocating for policy changes to make mental health care more accessible. In one of her books, JJ included a character who works at a community health center, explaining to another character the various programs and sliding scale options available for mental health care. Readers have reached out to JJ saying that this information in the book led them to seek out similar resource in their own communities. That's the power of storytelling. It can provide practical, life-changing information in a way that's accessible and engaging. Now, you might be wondering, how effective can novels really be in addressing such complex issues? Well, let me tell you, the power of storytelling should never be underestimated. JJ's novels have won several awards for their contribution to raising awareness about mental health issues in the African American community. But more importantly, they're changing lives. JJ shared with me countless stories of readers who have reached out to her saying that her books gave them the courage to seek help or help them understand a loved one's struggles better. One reader told JJ that after reading her book, they finally understood why their mother had been so resistant to therapy, and it opened up a dialogue that led to healing for their whole family. But JJ's impact goes beyond her writing. She's a living example of the change she wants to see. As a social worker, she's been on the front lines, witnessing firsthand the challenges faced by those seeking mental health care. As an attorney and magistrate in family court, she's seen how untreated mental health issues can tear families apart. And as a novelist, she's found a way to bring these experiences to life, to make them real and relatable to her readers. So, what can we learn from J.J. Winston's work? What can we do differently after hearing her message? First and foremost, we need to start talking. We need to break the silence surrounding mental health in our communities. Whether it's sharing our own experiences, supporting friends and family who are struggling, or simply being open to learning more about mental health, every conversation chips away at the stigma. JJ suggests starting small. Talk about mental health the way you talk about physical health. If you wouldn't hesitate to tell a friend you're going to the doctor for a checkup, why should mentioning a therapy appointment be any different? By normalizing these conversations, we can slowly but surely change the narrative around mental health in our communities. Secondly, we need to advocate for more representation in the mental health field. This could mean encouraging young people in our communities to consider careers in behavioral health, supporting organizations that provide scholarships for African Americans pursuing these fields, or demanding cultural competence training for all healthcare providers. JJ shared an inspiring story about a mentorship program she's involved with. which pairs young African Americans interested in mental health careers with established professionals in the field. The program has already seen several success stories, with participants going on to pursue degrees in psychology and social work. It's a reminder that sometimes all it takes is seeing someone who looks like you succeeding in a field to realize it's possible for you too. Thirdly, we need to push for policy changes that make mental health care more accessible and affordable. This could involve writing to our representatives, supporting organizations that advocate for healthcare reform, or even just educating ourselves and others about available resources and programs. JJ emphasized the importance of local action. She told me about a community initiative she was part of where they worked with local healthcare providers to offer free mental health screenings at community events. The initiative not only provided immediate help to those who needed it, but also raised awareness about mental health issues and available resources in the community. But perhaps most importantly, we need to change how we think about mental health. We need to start seeing it as an essential part of our overall well being, just as important as physical health. We need to understand that seeking help isn't a sign of weakness, but a sign of strength and self awareness. J.J. Winston's work reminds us that change doesn't always come in grand gestures or sweeping reforms. Sometimes it comes in the form of a story that touches our hearts, opens our minds, and inspires us to see the world differently. It comes in the form of a novelist who uses her words to heal, to educate, and to advocate. As we wrap up, I want to leave you with a challenge. Think about the last time you read a book that changed how you think about an important issue. Now, imagine if that book could also change how an entire community thinks about mental health. That's the power of J.J. Winston's work. And it's a power we all have within us, whether you're a writer, a teacher, a parent, or just someone who cares about your community. You have the ability to start conversations, to challenge stigmas, and to advocate for change. You have the power to be a J.J. Winston in your own right. So I ask you, how will you use your voice to break down barriers? How will you contribute to making mental health care accessible and acceptable in your community? The story of mental health in the African American community is still being written, and we all have a role to play in shaping its narrative. Remember, 1 in 4 people are living with a behavioral health issue. That means this isn't just someone else's problem, it's our problem. It's our challenge to face, our stigma to break, our community to heal. J.J. Winston's work shows us that change is possible, that stories have power, and that each of us can make a difference. So let's take up her challenge. Let's start talking, start listening, start advocating. Let's write a new chapter in the story of mental health in our communities, a chapter of understanding, acceptance, and healing. As we conclude this powerful conversation, I want you to take a moment, close your eyes, and imagine a world where seeking mental health care is as normal as going for a physical checkup. A world where every community has access to culturally competent mental health professionals, a world where the color of your skin or the size of your wallet doesn't determine your access to mental health care. Now, open your eyes. That world isn't just a dream, it's a possibility. And you, yes, you have the power to help make it a reality. So here's my call to action for you. This week, have one conversation about mental health. It could be with a friend, a family member, or even on social media. Share what you've learned today. Talk about the barriers we've discussed. Recommend one of J.J. Winston's books. Just start the conversation. And don't stop there. Look into mental health resources in your community. Are they adequate? Are they accessible? If not, what can you do to change that? Maybe it's volunteering. Maybe it's writing to your local representatives. Maybe it's organizing a community event to raise awareness. Remember, every great movement starts with a single step. Every revolution begins with one person deciding to make a change. You have the power to be that person. You have the power to break down barriers, to challenge stigmas, to change lives. J.J. Winston's work shows us the power of stories to change hearts and minds. Now it's time for you to be part of that story. It's time for you to write your own chapter in the ongoing narrative of mental health in our communities. So go out there, talk, listen, act. Be the change you want to see in the world of mental health because your voice matters, your story matters. And together we can create a future where mental health care is accessible, acceptable, and available to all. Thank you for joining us on this journey. Now, let's go out there and make a difference. The world is waiting for your voice, your story, your advocacy. Let's make mental health a priority, not just for ourselves, but for our entire community. Together, we can write a new narrative, one of hope, healing, and wholeness. The pen is in your hand. What story will you write?